As Victoria records its deadliest day, allegations have come to light of unanswered calls for help in aged care and an attempted security cover-up in the state's hotel quarantine bungle. It's been revealed that there were repeated calls for the government help from Melbourne aged care facility that's had the largest outbreak in the country. At one stage, the home had just one staff member for every 19 residents. Meanwhile, a leaked email has revealed an attempt to cover up the fact that security subcontractors at Melbourne's quarantine hotels were not told of their infection control obligations. It comes as the inquiry into the bungle system confirmed that 99% of genomically tested cases in Victoria can now be traced back to return travellers.
In New South Wales, the government is cracking down on schools and community sports in its attempt to prevent further spread of the virus. Students won't be able to mix with other year groups, and those with virus symptoms are now required to get tested before returning to class. Regional and state sporting competitions will also be cancelled to avoid travel between regions. We're going to have all the latest from our Sydney and Melbourne reporters shortly, but first, let's bring in Aged Care Minister Richard Colbeck, who joins me now from Devonport in Tasmania. Minister, welcome to breakfast.
Morning, Lisa.
I want to get to the specifics of the allegations we heard last night on Four Corners, but before then, I personally found it quite devastating hearing some of those reports, especially from the CEO of Epping Gardens. A lot of the criticism is directed back at you and your department. What was your reaction?
Well, Lisa, we didn't, or the Aged Care Quality and Safety Commissioner didn't apply a notice to agree to Epping Gardens without good cause. We were very concerned about the way that facility was being managed. We were having issues with cooperation. I had cause to make a number of calls to try and improve the cooperation. There were clear failings with respect to communication with families, and that's why the Aged Care and Quality Safety Commission acted to apply a notice to agree, because there were a number of things that we weren't happy about.
So you're putting it back on them? You're saying it's all their fault?
No, I'm not saying it's all their fault, but I'm just making the point that there were some things in that facility that we were clearly not happy with. They had a perception about the way things might be played out. Their expectation was that every COVID positive patient would go to hospital, and that's never been the position, particularly in Victoria. It is in South Australia and Queensland, but it's not in Victoria, and there's a process that we go through to manage that. But there were a number of things that we were concerned about. There were some issues with recruitment of staff, and that's clearly understood, and we continue to build measures on ensuring surge workforce, but we've got a situation in Victoria right now where the entire health and aged care workforce is under extreme stress, and recruiting staff, bearing in mind there are a number of other significant outbreaks going on at the same time, has been a real battle for us all.
So you're saying that nothing more could have been done when the CEO contacted federal departments and said, we're down to one staff member for every 19 residents. It got to a point where it wasn't safe for the residents and they needed more help, and they said that help didn't turn up.
Well, we did provide additional resources through our surge workforce processes. I'd have to go back to our case notes to look at specific timings, and there were periods of time where the level of staffing wasn't as it should have been. But as I said, the entire workforce in Victoria was under severe stress. There were a number of other major outbreaks, and our team, I can tell you, were working diligently around the clock till late at night every day, looking for workforce for a number of facilities.
Do you regret the decision, though, to not have patients accepted by hospitals? Is that a wrong decision, given that 28 people have now died from that nursing home?
Well, we've maintained a process of looking at each facility on a case-by-case basis. If somebody needs to go, they will to hospital. They will, and
but they're saying they got knocked back. They're saying they couldn't, that they weren't being able to get them into hospital.
They were asking for every resident who was COVID positive to be taken to hospital, and that's not the approach that's being taken. Clearly not the approach that's being taken. And that's why the decision made between the Commonwealth Government and the Victorian Government was so important when we released so much of that private hospital capacity to allow facilities to have residents transferred to assist with the management of workforce shortage, and that's what occurred at Epping Gardens. there were some transfers out so that the workforce capacity issues that we were finding inside could be managed within the facility, but we could also release that into some of the private hospitals when we reached agreement with the Victorian government to cease elective surgery. That's why that decision in Victoria was such an important one, and we continue to work closely with the Victorian government through the Victorian Aged Care Response Centre to manage facilities in just that manner.
Minister, you can forgive people for being a little frustrated or confused. I've gone back over transcripts, going back to April interviews that you've done with us and other programs, and there was this assurance that there was a plan, that there'd be surge workforces, that the people in aged care would be safe. And we now know that that didn't happen. Something has gone terribly wrong.
Well, there has been surge workforce, and we've continued to build that all the time, and we continue to do that. The issue is that you've had such a significant extent of community transfer of COVID-19, and nobody is safe in that circumstance. It's carried into aged care facilities with staff, and that's predominantly the way that it's been managed. They don't know they have it, and the infection spreads, and by the time we get the first test result, the infection in the facility has largely occurred.
Yeah, I know, it was 6 days. With Epping Gardens.
Those test results should have been back within 24 hours. That's the standard that we've insisted on.
So whose fault was that?
Those test results were transferred back to the facility and us via DHHS in Victoria, so Vic Health.
Right, okay. But going back to this idea of there being a plan, and you previously sort of confidently telling us that things were going to be okay. I mean, you didn't say way back then, hey, if it gets into aged care facilities and if we have a big spike, then all bets are off.
Well, no, I didn't say that, but I did say on many occasions that while ever there was community transmission, aged care was at risk. It's just the same as the situation in Victoria's hospitals right now, where you've got significant outbreaks in a number of Victoria's hospitals, largely being brought in by staff who are contracting the virus in the community, and similar issues within those facilities with respect to infection rates. So we have always acknowledged, and we've always said that while ever there was community transmission, there was going to be risk to everyone in the community, but particularly to residents in aged care, because they are the most vulnerable with respect to survival rates. And it's always been a concern. And the front line of our approach to the infection of COVID-19 all along has to be control community infection rates, because we understood only too graphically how devastating it would be if it gets into aged care, transmitted in by staff members who were showing those symptoms. They didn't know they had the virus, and they were infecting the facilities before anybody understood what was happening.
Well, the Prime Minister last week apologised, said he was deeply sorry. A lot of people have said that's not good enough. Are you sorry?
We are. Of course, we're sorry, and we extend our sincerest condolences to all of those who have been impacted by the virus, particularly those who have lost their loved ones. This is a tragic circumstance. And this is how devastating this virus is. You saw, can see from the advertisement that we've released yesterday, the impact of the virus, how silently, how furtively it continues to spread through the community. That's why we've been concerned about people obeying social distancing, observing cough and sneeze etiquette, staying home, not going out unless you really need to, because isolation.
And we do stress all that. We do stress all that, Minister. And just one last question. I mean, where do we go if we now put aside the mistakes that have been made? What's the future? Are people in aged care facilities safe in another state if there's a spike of coronavirus? What can you tell people?
While ever there is virus in the community and there's community risk, there is risk to everyone in the community, including people in aged care. You've got 3 people in isolation in a facility in Queensland right now that we've been advised of overnight. That is a genuine concern. The speed of action of that facility is very positive, but while ever there is virus in the community, we all remain at risk, but particularly people in residential aged care. And the only way that you stop that risk is to completely isolate aged care from the rest of the community. And there's a real question about the viability of actually shutting off the entire sector, because that has other concerns itself. And we've also heard in evidence to the Royal Commission last week about the impact of isolation on residents and their mental health. So this is an extremely stressful and distressing situation for us all. And again, my condolences to all of those who have lost loved ones because of the virus, and particularly because of the impact of it spread through the community.
All right, there's so much more we could talk about, but we've run out of time, I'm sorry. But Minister Colbeck, thank you for joining us this morning.
Thanks, Lisa.
Well, in other news, South Australian authorities are going to start testing hotel staff and security guards for coronavirus after another person in hotel quarantine tested positive. The latest case is a woman who was repatriated on a flight from India. Her partner has also tested positive. There are currently 8 active coronavirus cases in South Australia.
All Queensland federal MPs and senators who attend Parliament in Canberra next week will be forced into quarantine for 2 weeks when they return home. Queensland's Chief Health Officer has written to the Speaker of the House of Representatives saying because the ACT is considered a COVID-19 hotspot, Queenslanders need to be protected.
India's COVID-19 death toll has passed 50,000 following a deadly surge of fatalities in the past week. The outbreak has spread into rural areas and the country's total case numbers are approaching 3 million. Meanwhile, China has granted its first patent for a vaccine after recording no new domestic infections in more than a month. And Lebanon's caretaker health minister has called for a 2-week lockdown, with the country facing a spike in infections following the explosion in Beirut.
Let's go back to our top story now, and for the latest on coronavirus news in Victoria and New South Wales, I'm joined by reporter Steph Ferrier. She's in Melbourne. Kathleen Ferguson's in Sydney for us this morning. Good morning to both of you. Let's start in Melbourne first, and Steph, more details have emerged about Victoria's disastrous hotel quarantine system.
Yes, hi Michael. The ABC 7:30 has obtained emails suggesting that one of the country's major security providers, Wilson Security, breached its agreement with the Victorian government by failing to inform at least one of its subcontractors about hotel quarantine responsibilities. Now, the program has revealed that Wilson also tried to conceal its failings by asking that subcontractor to backdate documents some 9 weeks after security guards had already been hired to work at the hotels. Now, these emails were reviewed by Victoria's former Chief Crown Prosecutor, Gavin Silbert, and he says that that was a blatant request and Wilson was clearly trying to cover its tracks from any legal liability or blame. Now, Wilson had no cases of coronavirus at any of the hotels where its guards worked, and the company says that all contractors did have agreements in place and the subcontractors were well aware of their legal responsibilities and duties. Now, this comes just a few days before subcontracted security guards are set to give evidence before that independent inquiry into the botched hotel scheme. So we'll have more details still to come about that.
And Steph, there's no doubt, is there now, that Victoria's second wave can be traced back to return travellers?
Yes, yesterday we heard from the Doherty Institute's director who confirmed what we've all heard suggested for weeks now, that 99% of Victoria's current COVID-19 cases can be traced back to international travellers. He didn't specifically link them to those people who were in hotel quarantine, but he does say that they can be connected to 3 major clusters. Now, today we're expected to hear from another epidemiologist who should be able to give the percentage of those hotel quarantine cases. And of course, this all comes to light after yesterday's deadliest day in Australia since this pandemic began. 25 more Victorians died. Although our case numbers were remaining below the 300 mark, we had 282 new cases yesterday. So at least that is a positive sign that we are continuing to head in the right direction.
Let's hope that continues. Let's go to Sydney now. Kathleen, tougher coronavirus restrictions will be enforced again. What effects will they have on schools and sport in particular?
Yes, Michael. So these measures, which will come into effect for schools from tomorrow, will mean that there'll be a lot less social gatherings at schools. And the New South Wales Department of Education has actually issued an apology to Year 12 students because they won't be able to have formals or end-of-year graduation ceremonies within the next 6 weeks. School years will be separated, and also students who are sick won't be able to attend school. If they do turn up, they will be sent home and they'll have to return a negative coronavirus test before they can come back to school. It'll also mean that there's no choir practice and no use of wind instruments in groups. The New South Wales government yesterday said that it was focusing on singing and chanting because of the risk that those activities could pose to spreading coronavirus. For sport, it'll mean that schools won't be able to travel outside their local area to compete with other schools. The idea is that they won't seed infections in country New South Wales or in other areas of Sydney, and that's expected to be mirrored in local community sports as well. Regional, zone and state competitions, the advice is that they be cancelled, that if people are making their way to sporting games or to training, that they don't carpool with people outside their family or outside their household, the people that they're living with. And the New South Wales government is advising that post-training dinner sessions also be cancelled as well. So these measures are expected to be reassessed in 6 weeks' time, but the goal here is to really reduce the number of schools that are closing when there are coronavirus infections within the community, but also the ultimate goal is to reduce community transmission. Although there have been 7 cases reported yesterday, the New South Wales government is concerned about that low-level community transmission that's still happening.
Kathleen and Stephanie, thank you both for the updates there.
Well, let's stay in New South Wales because Sydney-siders with flu-like symptoms are being told they're more likely to have coronavirus than the flu.
The state's Chief Health Officer, Dr Kerry Chant, says the flu rate there is just 10% of what it was this time last year. She says it's essential that anyone showing symptoms gets tested, particularly in Sydney's west and southwest, where there is evidence of undetected spreading.
At the moment, we have very low rates of influenza circulating. So if you have symptoms, respiratory symptoms of cough, fever, sore throat, runny nose, headache, aches and pains, it is most likely that you have COVID.
The federal government has released a new television advertisement which is warning people about the threat of spreading COVID-19. Let's take a look.
My mum's in ICU with COVID. We visited her a few weeks ago, but I didn't know that I had COVID. I had no symptoms. A week earlier, my mate cooked dinner. Tom said he'd just had a cold. He works with Sophie, who said she just had a sniffle. We all had COVID and didn't know it. We can't change that, but we can all change what we do in the future. Be COVID safe and save lives.